I feel very fortunate to have met Julia Hartung, Dr. Julia Hartung, who is an oncologist and also a TCM practitioner. It's quite rare, I think it's a real rarity to see someone who is active in both fields. And I know from my experience as well and other practitioners, one of their biggest fear is actually the oncologist. They have a fear of the oncologist looking up on them or intimidating them. And even if the patients will tell the oncologist, I'm having an acupuncture session or a Chinese medicine herbs, that they will be intimidated, or the doctor will say, oh, I don't believe in it, I don't think it will help you. You're just, will give them something which is discouraging. So it creates this kind of, as I said, difficulty of bridging what we know, and we know from research, the Chinese medicine do to cancer patients, and the feeling cancer patients have, especially when they are seeing the oncologist or trusting their own field. Yep. So I would love to hear your response to this, and actually I think you are probably the one that can empower practitioners in the most strongest way to know that what they do is valid and is appreciated.
I know about these feelings of practitioners, and I think the best way to find out if it is like that, and many doctors are actually quite happy to cooperate with practitioners for Chinese medicine, just talk to them. You might have bad luck and they're just straightforward oncologists and they don't want to hear about it. But so many of my colleagues are quite happy about integrating medicine, oncology especially. We actually founded a group in our German Society for Oncology to talk about integrative medicine and to find ways to inform our colleagues about the chances of not only Chinese medicine. And we are quite surprised how many of our colleagues say, oh great, something else patient can do. And they know, some of them know about the facts, and they don't have a problem at all to patients going to see a general practitioner for TCM. And the best way really is to find out what the oncologist in your area think about it. Just give them ask them if they have time to talk to them for a moment, so that you can tell them about the studies and the research we have in TCM. And I'm quite sure about that a lot of doctors are quite happy, and if practitioners come and talk to them. I think one of the problems doctors have, that they think, oh God, all these strange things going on. But with Chinese medicine, they're actually quite open, and it's a big chance just to go and talk to them.
And I would like especially to know what's your impression of, because you're using both systems, what's your impression of the help and the effect of Chinese medicine and acupuncture on cancer patients?
I think it has a great impact on patients, starting with just a different view on things. They understand their symptoms better because we have a different view on the things, and they feel accepted as a whole system. They're not reduced to their tumor. We do things behind the tumor and what we can do for them behind the tumor, and this is really important for the patients, just to be recognized of more than the tumor, and that alone does help them a lot to cope with the situation and change things.
And from your experience, is acupuncture effective?
Definitely. I don't have to talk about it. It does definitely change things. Not only treating side effects of chemotherapy, but it does help them to change towards hope, and it does change their self-awareness, and it does help them to find the positive things which they've lost on the way of the treatment. They suddenly see a lot of strength they have, because you can, with acupuncture, you open a lot of resources they have lost on the way. So it's definitely helping patients a lot, definitely.
Okay, thank you so much.
Thank you.
Julia, and it's really great to hear someone that can feel comfortable in both worlds of Western and Chinese medicine and appreciate both.
It's a gift.
Well,
it's
thank
a present for me, and I enjoy it a lot.
Oh, thank you very much.